research shows that during the pandemic, up to 40% of women reported they skipped preventative health services and routine checkups. Joining us to discuss this alarming trend is Dr. Nkechi Azie and Nurse Barb Dean. Nurse Barb, let's start with you. How big of an issue was women skipping preventative health services during the pandemic? And thank you for being here.
Oh, Britt, thank you so much for having Dr. Nkechi Azie and myself here on behalf of SciNexus. And it was a huge problem, not just during the pandemic, but it's spilling over now. So a lot of women delayed their annual physicals, their pap smears, their mammograms, but they also delayed talking to providers about those very irritating vaginal infections and those yeast infections that never seem to go away. But guess what? It's May, it's Mother's Day is around the corner, so Women's Health Awareness Month. So now's the time to refocus on your own health care.
And there's some health conditions that women might want to ignore, but probably shouldn't. Can you guys speak to those?
Of course. You know, a lot of times we ignore things that are very personal and private, and we're just hoping they go away. And if you're suffering with a vaginal yeast infection, you're not alone. 7 out of 10 women, that's 70%, will have a yeast infection sometime during their life. And half of us will have recurrent episodes or multiple episodes during our lifetime. But don't let fear and embarrassment prevent you from talking to your healthcare provider, because there are some advancements.
Thanks for sharing that. Also, why is it important to see a doctor about infections or other health concerns instead of just suffering in silence?
Of course, as women, a lot of times we do suffer in silence. We put everybody else first. But when we ignore those symptoms, they just get worse. They're very, very uncomfortable. And Dr. Azie, you've really devoted your whole life to treating infectious diseases. But you were telling me that, you know, over the last 20 years, a lot of the treatments just don't work for everyone. What do you say about that?
No, Barb, this is why we have dedicated a lot of effort in working to get the patients that are suffering something new. And I am happy to tell my fellow women that while the COVID was raging on, the FDA actually approved an alternative treatment for yeast infection. So for the first time in 20 years, you actually have something different. I know in the last 20 years, whether you're getting over the counter or you're getting a prescription, it's the same type of medicine that works the same way. So when you have a disease that doesn't respond to that particular type of medicine, you did not have any relief. But now there is hope on the horizon, since there is this novel drug, first in class,